morning. This is Cristine Kao, the Global Marketing Director for HCIS. I'm here with Diana Nole this morning at the beautiful New Orleans HIMSS Conference 2013. Welcome.
Thank you.
We heard from the keynote yesterday at HIMSS talking about the late healthcare reform. Not to see it as a challenge to cut costs, but really an opportunity to improve workflow, operations, the whole infrastructure. How do you see us, help our customers address some of these, or maybe look forward to some opportunities?
Sure, yeah, great questions, because there's been a lot in the news, obviously, in the last year about healthcare reform, and then, budget cuts, and how do you match pay for performance and quality improvements with cost reductions and doing more with less. But I think since 2009, when we introduced the concepts of one desktop and also super PACs, we really have been focused on those things. So we realized that customers were going to be capital constrained, not have a lot of money, and yet be going through some things like acquisitions, really wanting to seamlessly try to bring together what might be disparate systems and actually have an ability through super PACs architecture to really talk about one system and one enterprise. So whether it's our system or another person's systems, we've had that concept of being able to connect them. We've continued on that journey up through 2013 and into the future. So a few things, obviously, that you're well aware of is beyond just getting the radiologist the tool set that they need to be most efficient, we have expanded in the last couple years really talking about the communities that need that information and how do you do that so that you can reduce repeats and patients going for multiple exams when they may not need it. So the introduction and the focus this year has really been on the patient and our introduction of MyView and the patient portal. One really quick thing is it reduces the cost of CDs. Yep. We've had some creative campaigns around, let's throw out all your CDs, yep, play fetch and give it to the dogs. And it's really exciting to start to see, even personally I've started to see for my own patient information that I can go and access it. Yep. And I can communicate that to other people in my healthcare community.
That's right.
So that is a way where you're giving kind of control where it should be, and then that also reduces costs at the same time. So that's a couple things that certainly have seemed to resonate with a lot of customers, which we're having some great success with that.
Absolutely. I think that ties well into the rapid adoption of ACOs or accountable care organizations, where the three metrics are patient satisfaction, referring satisfaction, and cost reduction. The thing that you just mentioned, for example, patient engagement, really ties in with all those three things.
Exactly.
So that's really a nice way to tie into that. And we actually also started this week with some great news with several contracts overseas, also up in Canada. More announcements to come shortly. What are some of the feedback you're hearing from customers? Obviously some of the innovative solutions is a key part.
Sure.
What else are you hearing from our customers, and why Carestream?
Yeah, so I do think that the investments that we've made have been producing results. So most particular, the radiologist desktop, the efficiency that they can get with some of the recent things that we've announced around the care of someone that may be in chronic treatment for cancer, as an example, where you're trying to manage their care around the lesion and the lesion management tools. Those things kind of grab the radiologist pretty quickly, but what I've also heard is people are very interested in this enterprise-wide imaging, the super PACs concept, the ability to kind of migrate in a cost-efficient manner. So it certainly helps with the fact that we have had past success that we can lean on. So managing things like some of the largest HMOs in the world with whether it's Kaiser or Clalit, the country of Scotland, that seems to resonate well because we have proven experience with this technology. It's not just vaporware, if you will. And we recently, as you have suggested, we have recently won some very large deals in the Asia part of the world, Northern Europe, had one recently that was signed here while we're at the show from Canada, #1 share in Latin America. So we are resonating, I think, quite well with our customers.
Absolutely, yeah. In fact, the CMIO from Norway came by our booth, and he was part of the evaluation committee. And the personal thing that he shared was, the team, the rest of the referring physician community was surprised that Carestream was selected. But because of all the legacy solutions that they had to deal with, but it was a pleasant surprise because once they saw what we offered, especially around, and he was really impressed with my view, the patient portal yesterday. I think that just kind of resonates well with what we're seeing across the world.
Yeah, so I think we kind of grab them with whatever seems to be of interest to them personally, but then we definitely have a full portfolio, again, whether it's the iPad certified solution from the FDA on, the referring physician or the patient portal. And certainly that goes to where are we headed in the future. And I think you're going to continue to see the expansion of what are the requirements of the referring community, the patients, speaking to the CIOs, what do they need to handle all of these disparate systems, the focus that we have on standards, so interoperability, all of those things, that's a path that we've been down now. We're on a single platform, and that really resonates well. They kind of see us as being a very stable player that's got a very concerted direction where we're going.
Absolutely. Great. Well, thank you so much for spending time with us.
You're very welcome. It's great to be here.